Welcome back. Oh, you got a crazy headache? Pain behind the eyes? Light sensitivity? Sounds like you got a migraine. I got you. We'll skip the Tylenol, we'll skip the Advil, we'll skip the Emitrex. I'm gonna write you a script for a couple shocks from a large black electrical fish. Strange? Well, this technique was used by the ancient Romans. What's even more shocking? It actually worked. It laid down the foundation for treatments that are on the medical horizon today. So let's discuss how we got here. The story starts in the 1st century. Arteros, a freed Roman slave, was walking on the beach, wetting his feet, not a care in the world. All of a sudden, zap, he felt immense pain and his foot began to throb. He looked down to see what the culprit was, and he saw a torpedo fish, a black torpedo, otherwise a type of electric ray. He gathered himself, and as the pain started to dissipate, he noticed something peculiar. He was a man who suffered from chronic gout, and the pain that was there before was gone. Somehow the pain from one had decreased the pain from the other. The fish shock somehow helped his chronic pain, and it's this phenomenon that we're talking about today. Even further in the 1st century, this phenomenon was later described again. It's described by Scorbonius Largus. He was a physician to the Roman Emperor Claudius. He wrote, "To immediately remove and permanently cure a headache that is long lasting, however intolerable, a live black torpedo is placed where the pain is until it grows numb." Translation: shock the pain away. Use this fish and its properties to remove or alter your pain. And what was being described is neuromodulation. And Scorbonius Largus is credited, at least for describing neuromodulation. Essentially what he was describing was changing the perception or pathway of electricity or pain to treat headaches. And it wasn't just used to treat headaches back then. It was used to treat gout. It was used to treat arthritis. And it was even used for the treatment of pain caused by anal prolapse. Ugh. So nowadays we understand what was being generated by the fish was electricity, and electricity was being used on the pain that was being perceived by the humans or by the Romans, all that. So now we have to discuss a little bit about the properties of the black torpedo. Again, it's a type of electric ray that can discharge electricity. The species can generate anywhere from 30 to 200 volts of electricity. And that's the difference between a light tingle and knocking you on your feet. There are some 69 different species of torpedo fish or electric rays throughout the world. And on the sides of their heads, they have organs that allows them to discharge electricity as a defense mechanism. Without knowing it, the Romans used this mechanism, or used the pathway for this mechanism, to help treat headaches and numb pain. So what is headache pain actually? Well, the brain itself doesn't have any pain receptors, but the structures around it do. There's receptors, nociceptors, lurking throughout the muscle, the veins, the scalp, the face. And when those go awire, we get headache or migraine pain. And once these nociceptors are activated, they can cause inflammation of the blood vessels, tightness in the muscles around the head, and they just irritate the nerves. And messages are sent from the place of the original pain to the brain, and that's what we perceive. So different treatments can be used, decreasing inflammation in the veins, relaxing the muscles, or blocking pain signals help with migraines. And it's this last point that's most important, alternating or changing the pathway of pain. That's neuromodulation. A better definition of neuromodulation is the act of alternating the activity of the nervous system. You think back to our Roman gentleman's foot. The pathway for the original pain he felt from the gout was essentially zapped away or altered. And with neuromodulation, you are changing or exciting, sometimes reducing the activity of nerve cells. Now, does this mean I should get jumper cables or get a large electrical fish and zap your pain away, shock it away? No. Nowadays, most headaches, migraines are treated with oral treatments. But some migraines are refractory. Not all migraines are the same. And so for these complex migraines, we need different treatments. Since the early 2000s, some new devices are being studied and they're under clinical trial. Two devices being used, the occipital nerve stimulator as well as the transcranial magnetic stimulator. And these devices essentially alter the electric pathways of pain perceived by migraines, and they either reduce the pain, reduce the frequency, or the intensity of migraine. So this is where we are in medicine, looking back to move forward, looking at concepts some 2,000 years ago to help us treat patients now. Anyways, thanks for listening. And remember, some of the weirdest, wildest things in science can have a great impact nowadays. Stay curious.